Hello everyone. I, Dr. Maya Varghese, Associate Professor, Department of Sharlitantra, Susrata Ayurveda Medical College, welcome you all for the webinar series conducted as a part of 5th Ayurveda Day celebrations 2020 in collaboration with Vishwa Ayurveda Parishad. Today, we have 3 sessions by Dr. Manjidar Joshi R, Dr. Sambat Vanishree, and Dr. Ruba L. Before the presentations, I would like to call Archita and Arpita for the prayer.
Shuklam Bharadaram Vishnum Shashivarnam Chaturbhujam Prasannavadanam Dhyaye Sarvavighnopashantaye Sarvavighnopashantaye Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kuru Me Deva Sarvakaryeshu Sarvada Sarvakaryeshu Sarvada.
Thank you, dear students. The first presentation is by Dr. Manjidar Joshi R, Associate Professor, Department of Sharlitantra, who is a versatile proctologist and a good clinician. And the topic for today's presentation is anorectal diseases and their treatment modalities. I welcome you, sir, for the presentation. Sir?
Hello, madam.
Sir, you can present, sir.
Okay, thank you, madam. I would like to, good afternoon, everyone. I would like to thank our director, sir, and as well as our principal, sir, for giving me an opportunity to share my views on regarding the anorectal diseases. I'll start with the prayer. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruvai Namah. Good afternoon, everyone. As you know, some of the symptoms as well as disease are more common and prevailing. When we see the total statistical value, at least 50% or 50% to 70% of the people will be suffering with one or the other problems of the anorectal diseases, like symptoms. Not the disease, may not be proper disease, but maybe symptoms. For example, some of the common symptoms are there, very common, like constipation, bleeding, pain or burning sensation, mass or swelling, itching, as well as pus discharge. These are the most commonest symptoms which we come across regarding the anorectal diseases or anorectal problem. Most of the patients will come with these presentations only, and some of the most commonest diseases related to anorectal diseases are fissure in ano, piles, fistula in ano, anorectal abscesses, as well as perianal pruritus ani and piloneal sinus. Before starting to the pathological aspect of the diseases, we should know the normal physiological thing. One thing I want to say that as some people are from non-medical fraternity, I don't want to go in detail as well as technical aspects, but I'll try to explain very general or as well as commonest terms which common people also can able to understand. Okay, first we should know the act of the defecation, that is a physiology of the act of the defecation, because most of the anorectal problems depends or starts with this problem only. Like, for example, when you have some picture on the screen. Hello, can I continue?
Of course, sir, you can continue.
Okay, thank you. So on screen you can see one picture where it is a picture of the rectum as well as anal canal. Where I'm placing my cursor is the rectum, and from here it is the anal canal. In very vague terms as well as general terms, if we say this is a rectum where the motion comes and accumulate, acts as a storage. And when this is a 4 centimeter tube-like structure known as the anal canal, which is surrounded by two group of muscles. This is the internal sphincters and this is the external sphincters. Normally, what happens when motion comes and accumulate in the rectum, start stretching, and some impulse will be sent to brain, and from brain some impulse will be sent back to the muscles, saying that open it up. Then it opens and easy evacuation happen. This is the normal physiological thing how the act of defecation will happen. In some circumstances, what happen? The process of defecation will not happen properly. Properly means these muscles will not act properly. At that time, we need to strain or give the pressure to pass the motion. Then here all the problem will starts from here only. So we'll go by one. First one, disease or symptom per se, constipation. Constipation is the first part where all the problem will start. Not only constipation, we can say it as the altered bowel habit. Altered bowel habit means sometime it is constipation and sometime it is the loose stools. What do you mean by constipation? Like a technical definition goes differently, but what patient explains to us or what patient can understand or general population can understand with the definition of the constipation is a person who is not passing stools properly or need to give the pressure to pass the motions, or when he give the pressure but still he feels that he has not incomplete evacuation. That is the feeling of incomplete evacuation and giving this pressure to pass the motion. And sometimes patient may pass alternate days or twice in a day. That is what, even though a person may pass twice in a day, but still if he feels that incomplete evacuation or hard motions are there, need to give the pressure to pass the motion, then still it will comes under the heading of the constipation. So when the constipation is there, all the problem will start from here. So we'll go one by one. First one, that is the piles. General terms like piles, technical definitions goes like this. That is the sinusites are there, arteriovenous sinusites, which is going to increase. That is the bulge of the arteriovenous sinusites in the anal cushions. That is a technical definition. Just we'll forget about that one. On the screen, you can see one picture, which is the rectum as well as anal canal. In this picture, you can see here where I have placed the cursor. This is the vessel. These are the vessels. Okay. It is present for everyone. For every person, these vessels are present. But in some circumstances, this vessel's size of the vessel is going to increase. When the size of the vessels are going to increase means when we sit for the longer period, lack of physical activity, or when we strain for the constipation or straining while the evacuation, and using more of the Western toilets, as well as traveling for the longer distance, and high protein diet as well as low fiber diet, any of these causes constipation. And when the person start giving pressure to pass the motion, at that time it passes over these vessels and it becomes loose and it gets enlarged. The attachment will get loose and its size is going to increase. Then we say it as a piles. In piles, two kinds of piles are there. If it is present inside, we say it as an internal piles, and if it is present outside, then we say it as an external piles. Okay. So these internal piles are further divided into, or it is having some different stages: first degree, second degree, third degree, as well as fourth degree. In first degree, what happened? Slight elevation from its place, as well as sometime occasional bleeding will be the complaint. Slight elevation will not be felt by the patient, but what patient feels is like bleeding, that too specifically painless bleeding. painless bleeding is very important, one of the important clinical presentation of the hemorrhoids or the piles. Piles, please remember, piles are not having pain, or piles are painless. If pain is there, then it indicates that either there may be blood clot in the vessels, that is the piles, which we say technically as the thrombosed piles. It may be internal or it may be external. That thrombosed piles or strangulated piles, then only pain will be there, otherwise pain will not be there. It's a painless condition. Painless bleeding will be the main clinical presentation in case of the hemorrhoids. So coming to the second degree hemorrhoids, where the small mass will be formed while passing motion, it comes out and it will go back by itself. Many a time we will not be aware of it. That is what we say, that is a second degree hemorrhoids. And third degree, when while passing the motion, it comes out and need to push it back inside. That is a third degree hemorrhoids. And fourth degree means it comes out and stay like that only. That is the fourth degree hemorrhoids. So here, two important symptoms are there, like bleeding as well as mass. Bleeding and mass are the only clinical presentations or symptoms present in the piles. Pain will not be there. Pain, yes, it will be there unless and until some blood clots or a strangulation, that is blood supply to the piles is hampered, then only that condition is known as the strangulation. In only these two conditions, pain will be more. Otherwise, it will be a painless condition. Okay, so piles generally 4 categories, and main clinical presentation only 2, that is the bleeding as well as mass. Coming to the next clinical presentation, that is the fissure in ano. Fissure in ano, it's nothing but it's a linear ulceration. Please see that one picture is there, and I am placing the cursor on the ulcer. That is a linear ulceration or a tear of the anal mucosa. Tear or the linear ulceration in the anal mucosa is known as a fissure in ano. Okay, if person is suffering from the fissure, then clinical presentation will be the pain. Here importance of pain will come. Pain means different kinds of pain will be explained by the patients. Types of pain as well as durations are very important in case of the fissure in ano. For example, pain will be there sometimes, that is cutting type of pain. That is what patient explains. Something cutting type of pain will be there, or burning type of pain. These are the two kinds of pain, either cutting type of pain or burning type of pain, during as well as after defecation. It is having relation with motions. That is the during as well as after defecation. During that time, patient will be having the pain in terms of either cutting type of pain or burning type of pain, and it persists for half an hour to 1 hour maximum. Half an hour to 1 hour it persists, and later on it will subsides, and throughout the day patient will be happy, as if he doesn't have any problem regarding pain. Okay, that is one of the main clinical presentation. But very important thing is, if person or patient is having pain more than 2 hours continuously after passing the stools, it indicates that fissures will be associated with the underlying infection. Always this is very important for regular this one persons also, as well as for the clinicians also. Pain in case of the fissure, if persisting more than 2 hours continuously after passing motion, it will not be a simple fissure. Please see that underlying the fissure there will be infection known as the intersphincteric sinus will be formed. Because of the sinus, some infection is there, a bed of the this is the wound. Below this wound some infection will be there. Because of that infection, it is not allowing the wound to heal properly. That is why chronic fissures, its edges or the margins are fibrosed and they will not be get united. Anal mucosa will be teared completely, and internal sphincters will be visible. But whatever it may be technical part, clinically what patients feels is pain till half an hour to 1 hour, either it may be cutting type of pain or it may be burning type of pain. Because why I am stressing more on fissures, because at least 50% of the patient who comes to our clinic are having the fissures, at least 50%, minimum 50%. And generally what the people will say, that is a Moolavadi, most of the condition it will be fissures in Venu. That's why I'm giving little bit more time for the fissures. Coming to the next part, like fissures, pain is one part and bleeding is the another part. Bleeding means here what kind of bleeding will be there? Bleeding will be there, that is the blood on stools is the main clinical presentation. Blood on stools is main clinical presentation in case of the fissures. But earlier, contradictory, in case of the piles, bleeding will be there. That too drop by drop kind of bleeding or syringing type of bleeding will be there in case of the hemorrhoids or piles. But in case of fissures, usually blood will be there on stools, blood on stools, pain, burning sensation or cutting type of pain persisting for half an hour to 1 hour maximum. Later on, it will subside. That is a clinical presentation of the fissures. Coming to next one, that is a fistula in ano. Fistula in ano. Before going to fistula in ano, I want to come to the perianal abscess. Perianal abscess, as everyone know, that is a abscess means some pus collection. Pus collection will be there. How that pus collection will be there? Simple pathology, if we want to explain, this is the internal sphincters and this is the external sphincters. And here is a column of Margogni is there and some pits are present here, columns. So some anal glands are present in between these two sphincters, anal glands, just similar to that of the salivary glands. Glands which opens into anal canal in the crypts or the small opening in the anal canal with a tube. Okay, here glands will be there with a tube. It will open into the crypts and it secretes some secretions which will help for the maintenance of the anal canal, its liquidity, as well as for the easy evacuations also it will be helpful. In some circumstances, like whenever there is the altered bowel habit means either there may be hard stools or sometimes there may be loose stools. In that conditions, what happens, small stool particle will enter into the tube and it gets blocked. Once the tube gets blocked, some collection will be there, whatever the collection of the anal gland, it will stay there only. Anything stays for the longer period is meant for developing the infections. So most commonest type of infections are here, that is the E. coli bacteria, streptococcal, staphylococcal, different kinds of bacteria may develop. Once the bacteria develops, then it will lead to the inflammation, then later on suppuration followed by abscess formation, that is the pus formation will be there. Once the pus is formed, during the formation of the pus, it is collected. Because of this stretch, person will be having severe pain. When person is having perianal abscess, clinical presentation will be severe pain. That is the throbbing type of pain, throbbing type of pain and continuous kind of pain. This is very, very important. In case of fissures, pain was there, but pain will persist for half an hour to 1 hour. Later on, pain will subside. But in case of perianal abscesses, pain will be persisting throughout the day. That is a continuous kind of pain, as well as throbbing type of pain is the one of the main clinical presentation. That is one. Second one is there will be swelling. There will be swelling in the perianal region. That swelling will be hard, tender and severe painful. Hard, tender and little bit reddish will be there, and patient will explain like this, like, doctor, I am not able to sit properly. That is what a patient will explains. And also patient explains that I am not able to sit, not able to sleep, anytime continuous kind of pain will be there. And sometime it will be associated with fever also. That is the toxic feeling or toxic signs are also present in case of the perianal abscess. So if person is having perianal abscess, usual clinical presentation will be pain is the main dominating feature, that is continuous kind of pain, and throbbing type of pain, swelling, sometime associated with fever. So this is the main clinical presentation. Technically, these are present at different sites where the abscess is found. Depending upon that, different kinds of names has been given. Whatever the name is given, pathology is same. That is the infection of the anal glands. And sometimes apart from this one, for example, the supralevators here, anal glands may not be there, but still abscesses will be formed. That is why possibilities, supralevator abscess means this is the levator muscles. Above this one, abscess is formed. Why this abscess is formed? Many a times it is not related to cryptoglandular infection theory. Someone theory is there why perianal abscesses or fistulas forms. That is mainly because of the cryptoglandular infection theory, but this will not hold good in case of the supralevator type of abscess or fistula. Here systemic involvement will be there many a time. A systemic involvement where patient will be diabetic, patient may be tuberculosis patient or immunocompromised patients. In possibilities are there like immunocompromised, tuberculosis or diabetic patient. Supralevator abscess are more common, but other kinds of fistula, other kind of abscesses or fistulas are more common in any other persons where cryptoglandular theory will hold good. So clinical presentations and technical parts will not go in detail. When pus is accumulated, when treatment modality in case of abscess, either it has to be opened and pus has to be removed. That is one way. Other way, naturally, it will find its way by itself. For example, here pus is formed. Okay, in intersphincteric region, if pus is formed, and it will find a way where the structures, anatomical structures are weak, or where it can give the way very easily. In that direction, it will travel and open into outside, like it has to drain properly. That is what the aim. So either it may enter into the anal canal or rectum where internal openings will be formed. Then we say it as a sinus. Sometimes it will passes the sphincters, or without crossing the sphincters also, it comes out in the perianal region, it opens and pus will be drained. So if two openings are present, for example, we'll go back here. We can see two openings, like one opening is present at perianal region, another opening is present in the anal canal. Here also we can see two openings, different kinds, this kind of tracts which communicates between the anal canal or rectum to the perianal skin, then condition is known as the fistula in ano. Fistula in ano is very important topic for Ayurvedic people, because most of the patients will come with the fistula in ano conditions because of lack of surgeries, like success rate in the modern type of the surgeries. That is why most of the people will come for the Ayurvedic surgeons in case of the fistula in ano, because fistula in ano, two important things are there. One is recurrence, second one is incontinence. These are the some major complications which has to be balanced in the treatment of the fistula. Before going for the treatment modalities, we will come to the clinical presentation. Clinical presentation of the fistula is very simple. Some discharging sinus or discharging pus. Patient will complain, some pus will be coming out. That is one. Or sometime patient will say some undergarments will be wet, but they don't know from where it is coming. Means second one, it indicates some sinus where the only internal opening is present, external opening is not present. Second way is patient says direct coming out from one place, it indicates that the external opening is present. So clinical presentation, pus will be there, pain will be there. Sometimes this pain occasionally comes and goes. Occasionally comes and goes. How it happens means when the external opening or internal opening is closed, pus will be collected in the tract. When it is collected, at that time it is going to stretch. Because of stretch, pain will be felt. So during this phase, patient will be having pain. Once the internal opening or external opening, it opens and pus drains out, then pain will come down. Then patient will be comfortable till next episode. So this is the episodic kind of thing. Sometime pain, external opening, internal opening, close, collection, swelling, pain. Then once again it opens, pus drains out, pain will come down. This is the typical clinical presentation in case of the fistula in ano. There are technical terms like different kinds of fistulas, intersphincteric fistula, this is intersphincteric fistula, this is transsphincteric fistula, this is supraelevator fistula, this is high anal fistula. What we say, high anal fistulas means internal opening will be present in the anal canal, but still it goes higher up and crosses the sphincters, external sphincters. Here this is the levator ani and comes down in the intersphincteric space and opens into the cryptoglandular area. So this kind of fistulas are there. Technically different kinds of fistulas, whatever it may be, clinical presentation will remain same. Next, this one, another most commonest thing will be, most of the people will come saying that some itching is there in the anal region. That is what the main clinical presentation of the pruritus ani. Itching is very important. Many people will say some itching is there, sir. In wherever we go, some itching is there. So it will be embarrassing for us. That is what the main complaint. Why this itching happens means there will be mild inflammation of the skin, perianal skin. Then itching will be there. That dryness will be there, itching will be there. Many a time it will be a precursor of the infection, underlying infection also possibilities are there. And another most commonest cause will be the worms. In case of the worms also, possibilities of pruritus ani will be there. That is, the itching is one of the clinical presentation. Another condition is there, that is the pilonidal sinus. Pilonidal sinus means some pilo is that is the hair, ball of hair which is present in the wound. This is a wound where the ball of hairs will be present. That how it happens means in the back, that is in between the buttocks, not in the anal region, lower region, in the coccyx region. What happens? Tough hairs will comes and fall, maybe because of the gravity. And as that area is always little bit wet, skin will be little bit fragile. Once the tough hair comes and cause the irritation and cause the ulceration, because of that ulceration, then abscesses will form, that is the infection will form, and because of the infection, cavity will be formed. Because of cavity, it will be attracting some hairs, tough hairs, so that tough hairs will enters into it and acts as a foreign body. Then clinically it presents as some pain or swelling in the lower back region associated with some pus discharge kind of thing. When pus comes out, then patient will be comfortable. When pus accumulates and external opening, this is the external opening, if it close, then once again pain will be there. This is what pilonidal sinus condition. It is very rare, and most important thing is it is more common in case of the person who are having hairs in the back. That is what explanation given. But nowadays they are saying, like recent studies says that it is not because of the hairs which are present in the back, but it is mainly because of the hairs of the occiput region. Hairs of the occiput region which falls there and causes the infection. That is what recent studies says, but still it is a controversial topic. Coming to next thing, that is the rectal carcinoma. This is very important because most of the people in general, what they will say, if some bleeding is there or any problem in the bottom case, then they'll think that it will turn out into the carcinoma or it will turn out into cancer. Okay, or sometime vice versa. If they have some carcinoma also, bleeding is one of the general clinical presentation. That is what they think, that it's a regular kind of bleeding, or think that it's a heat. Person thinks that I am having little bit heat, so that they try to take some local medicines by themselves, or take some coconut water and just try to compile it off. But it should not happen. Nowadays we have seen that around 25 to 30 years patient turning out into a rectal carcinoma, where examination was not done properly. For one story I want to share, a small story. One lady around 28 years having the bleeding per rectum, and she went to some Ayurvedic physician and took some medicines without any examination, took some medicines, and later on bleeding has not stopped. Okay, then what happened? She went to one allopathic surgeon also. Allopathic surgeon also, he didn't do the proctoscopic examination, just he did a little bit. At the same time, she was having little bit proctitis as well as fissures also. A sphincter spasm was there. So surgeon tried to do per rectal examination. He could not do because of the spasm. Then later on, he started treating it as a fissure in. Okay, later on, patient has come to me, and we examined, gave some injection, so that pain has come down. After diclofenac injection, pain has come down. Later on, we did the rectoscopic examination with video and all, and patient was turned out into the rectal carcinoma. So please be very careful. Request all the Ayurvedic physicians also, if patient complains of painless bleeding or pain with pain also bleeding, if bleeding is the complaint, and treat them, no problem, but treat for very shorter time, like for 1 week and all you can treat. If it doesn't subside, then kindly do the rectal examination. That is very, very important. Without doing rectal examination, if patient complains of bleeding, then it should be a crime. So kindly I request everyone, please don't do that one. Kindly do the rectoscopic examination or simple proctoscopic examination. If you have a camera, that is well and good, you can use. Otherwise, no need. That is fine. No. If person is having rectal carcinoma, clinical presentation is bleeding is one of the main clinical presentation. But difference is there. In case of hemorrhoids, bleeding is there. The blood is red in color. That is bright red in color. But here bleeding will be there, where it is associated or it is mixed with mucus as well as pus also. And pattern of bleeding also varies. In case of the hemorrhoids, bleeding will be there during or after passing the motion. But in case of the rectal carcinoma, bleeding will be there just before passing the motion. Without passing the motion, blood mixed with mucus as well as pus will be there. So that condition is known as a spurious diarrhea. And pain will be there. Initially, pain will not be there. Once a metastasis starts, then only pain will be there. Then only pain will be there. Otherwise, it is painless condition. That is why we should be very careful in treating bleeding per rectum. Please take history properly, do the examination, and treat. Okay. These are the commonest anorectal diseases which we come across. In general, I have not given the individual disease etiology, but just we will discuss in general etiology of the anorectal disease. First one, the heredity, that is genetic. Genetic, it goes more towards the rectal carcinoma rather than any other diseases. Second one will be the morphological condition, that is erect posture itself is that is what we are prone for getting the hemorrhoids, where four-legged animals will not have the hemorrhoids or piles. exacerbating features like constipation. As we discussed earlier, it may not be constipation only, it is we consider as a altered bowel habit, where constipation or loose stools are one of the major contributing features in case of the any of the anorectal diseases. And panchakarma ati yoga, as we know, either in case of the ati yoga of the virechana, or in case of the basti dana type of the complications, where it may lead to some of the anal diseases. For many a time it will be fissures, and sometime it may be external hemorrhoids. External thrombosed hemorrhoids are, these are the two clinical complications which can happen by doing the panchakarma if it is not done properly. Other features, as already we discussed, like traveling for a longer period, weightlifting or heavy work, and sitting and straining or spending more time in the toilet, as well as obesity. These are some of the other etiological factors. Then coming to the clinical presentation. Clinical presentation in general, itching, burning, bleeding, and pain. These are the most commonest clinical presentation, which already we discussed earlier in case of any of the anorectal diseases. Coming to the treatment modality. Coming to the treatment modalities. As per, excuse me.
Sir?
Yes. Yes, madam.
Yes, sir. Yeah, you asked.
Okay. Okay. Next will be the treatment modalities. In case of treatment modalities, as per Sushuta's line of treatment, which he mentioned, that is Beshaja Chikitsa, Kshara Karma or Kshara Sutra, Agni Karma, as well as Shastra Karma. These are the four main treatment modalities has been mentioned for management of the anorectal diseases. We'll go one by one. That is the Beshaja Chikitsa. Beshaja means what? It is in medicines, either internal medicines or external medications. Internal medications in terms of tablets, syrups, whatever it may be. And external topical applications, like in terms of the gels, cream, and oils, other things. Coming to the Kshara Sutra or Kshara Karma, it is one of the treatment modalities which has been mentioned, where the in 4000 years ago, Sushruta, in 2nd century BC, Sushruta, he classified treatment modalities so nicely that it holds presently still a better line of treatment than any other line of treatment. When Hippocrates was using a red hot rod for the treatment of the piles, in that time only, Sushruta was, before that one only, Sushruta was given very nice line of treatment. Still it holds good, and we are treating very nicely with this line of treatment. Kshara Sutra means it's a thread, medicated thread, which is having 21 coating of the medications, which will be used to tie for the hemorrhoids or for the fistulas, which is having medicines, slow and sustained release of this medicine, that is the chemicals, especially that is a kshara. It is going to cut the tract and heal simultaneously in case of fistulas, as well as in case of the hemorrhoids. It is going to cause the vascular necrosis at the same time. Healing also will happen properly. That is why we come across like other complications like bleeding and all are very less in case of the hemorrhoidal treatments also. And coming to the Agni Karma is nothing but that is a red hot instrument or a heat source used for cutting or coagulation or ablation. Earlier, Sushruta used some shalakas, different kinds of shalakas, as well as shastras. Yantra as well as shastras. Shastras are the sharp instruments. Sharp instruments are made into red hot and used for the cutting purpose. That is the or other part, that is the yantras, where the blunt instruments used to make the red hot and for use for the ablation. Shastras red hot used for cutting and coagulation. Yantras used for coagulation as well as ablation. Earlier, shalakas were used. Nowadays, different techniques has been explained, and we'll go through that one. And Shastra Karma, that is a surgical intervention For example, if there is a 4-degree hemorrhoids where the mass has come out and cannot be treated with any of the line of treatment which has been mentioned, then next option will be the excision. That is the part which has got thrombosed or strangulated, that part has to be excised. Then only a perfect line of treatment can be drawn. Otherwise, it will be severe, painful, as well as other complications may happen. As a thrombus mass, if it stays for the longer period, it may get infected and turns into the fistulas. So in that condition, Shastrakarma is the ideal line of treatment which has to be adopted. That is what the Sushrutas line of treatment, he explains about that one. And these are some of the medications as per doshic involvement, different kinds of medicines we use in our clinics. Vataja, Pittaja, and Kaphaja, Raktaja. As per doshic classification and different yogas has been mentioned, we use and give very good results with that one. So that is a Beshaja Chikitsa. Next one is Agni Karma. So Agni Karma is, you can see here, this is a shalaka and it is made red hot using the flame, and this shalaka used to be used for the treatment of the piles. But nowadays we cannot use the same in case of the treatment of the piles or anything, because there are some other newer technologies has been come. As the basic principle remains same, that is the heat source is used for the treatment of the piles or fistulas. Keeping in the mind that basic principles, nowadays we are using this is the diathermic cautery, where the electrical energy is converted into heat energy, and from that heat cutting and coagulation will happen. The same thing here, this is a radio frequency unit, what we say radio frequency unit, electrical energy is converted into radio frequency energy, radio frequency is converted into heat energy, later on used for the purpose. Cutting as well as coagulation, these two works same, plus or minus same. There is no much difference between these two. This diathermic cautery and this is a radio frequency cautery. Usage will be same. Only difference is, in case of the diathermic cautery, if I take one small linear incision, adjacent 3 millimeter adjacent tissue damage will be there. But if I use the radio frequency unit, I take this incision, only 1 millimeter adjacent tissue damage will be there. At the same time, this is a lasers which we use. If I take one small incision, only line of incision tissue damage will be there. That is a minimal tissue damage will be there using the lasers. As well as this is another treatment modality, infrared coagulator. This also works same thing, that is the heat energy, electrical energy is converted into heat by the reflector will be there, gold reflectors will be there, halogen bulb is there, gold reflector, and quartz tube will be there, and that is a Teflon coating will be there for the tip, where it doesn't get attached to this mucous membrane. That is how the principle it works. Means basic principle remains same, that is the heat source is used for the treatment of the hemorrhoids or a fistula. So, but nowadays, instead of using these kind of the shalakas, we are using different kinds of treatment modalities. So coming to the Kshara Karma as well as Kshara Sutra. Kshara Sutra is ideal treatment in case of the high anal fistulas, because recurrence rate is only 1 to 3% only, compared to modern surgery. It may be fistulotomy or fistulectomy. If it is a fistulotomy or fistulectomy, if it is done properly, recurrence chances are less. But because of fear of cutting of the external sphincters, many a time complete surgery will not be done. Chances of recurrence are very high. Earlier, as we discussed, two things are important in case of the treating the fistulas. One, it's recurrence rate. Second one is one of the major complication, that is the continence. Continence means that is a control over the motion. If these muscles, external sphincters, if these muscles are cut, then chances of control over motion will be lost. Control over the motion means here incontinence is not only for the solid, incontinence is for liquid as well as gaseous. As we know, when we see the physiological aspect, this is the anal cushion. Anal cushion has very fine fibers, nerve endings, which can identify what is solid, what is liquid, and what is gaseous. That is why we are able to fart properly whenever other persons are not there, identifying that there is only gas. But when other persons are there in social stigma, we'll try to withhold that one. Means that organ is so sophisticated that it can identify what is the content of the rectum as well as anal canal. If any of these surgeries, uh, chances of getting loss of these anal cushions, that is one, like in case of the hemorrhoidectomy, or in case of the uh, hemorrhoidal, this one, external sphincters only damaged, then also chances of control over the stools will be there. That is why very important thing we need to balance, and Kshara Sutra will do that one. This is a Shastra Karma, as we say, that is the excision. That is the either Shastra Karma, which indicated in case of the Arsha as well as Bagandhara, that is the hemorrhoids as well as fistula, that is ectomy. Chitwa Dahet is the line of treatment which has been mentioned. Chitwa means that is a excise completely. Nisheshataha chedaniyanam chedya. That is, without leaving any part, it has to be excised. That is what the hemorrhoidectomy principle says, or any type of ectomy kind of surgeries. But it has its own advantage as well as it has its own disadvantages also. But this Shastra Karma, very rarely we do the Shastra Karma. 90% of the cases will be treated with only Kshara Karma as well as Agni Karma only. Shastra Karma is very rarely we do it. And as we mentioned, these are the instruments which are present in our colleges. Also, we are using these two instruments, and very soon we may get lasers also for the treating bottom cases. So one part, if disease happen, then how to treat it. Second part, how to prevent it. Simple thing, that is the correct lifestyle correction. Lifestyle correction is one is that is proper exercises, and don't spend more time in the toilets, means don't strain, and eat healthy foods. Eat healthy food means where the fiber rich diet has to be taken. These are the do's and don'ts, where the fiber rich diets and less of the maida foods has to be taken. What has to be avoided is more important rather than what has to be taken. Like more of the spicy food as well as non-veg food has to be avoided, and any products prepared with maida, better to avoid that one. Rest of the thing are fine, no problem. Or in general, very in simple way, if we want to say, then we should say that whatever food we eat, make sure that it should be little bit semi-solid kind of food. Like rice means more of rasam, more of sambar kind of thing has to be taken, rather than dry kind of food should not be taken. Dry kind of food will be, if we take dry kind of food, then it will cause the bowel will become hard. Once the bowel will become hard, intestinal motility also will be reduced, and need to give the pressure for passing the motion, then all the problems will start. So as we mentioned, regular exercises and all this has to be carried out. And very important thing is like sitz bath. Sitz bath is nothing but Avagahas Veda, what we consider, where the lukewarm kashayam or lukewarm water has to be, will be put into the tub, and we ask the patient to sit into it. 2-3 benefits we get. One, that area will be clean, hygiene will be maintained, that is one. Second one, pain, burning sensation will be reduced because of the hot as well as medicines we use in that one. If small fissures are there, pruritus ani, or in that condition also, small ulcers also will heal. Pain also drastically will come down by doing the sitz bath, as well as perineal muscles will be loose. sphincter tightness will be reduced. That is how the sitz bath will be helpful. And sitz bath gives very drastic pain relieving factor. Once when I was doing post graduation, we did one hemorrhoid surgery, that is the Kshara Sutra we put, and a patient was having severe pain. Severe means severe kind of pain. Later on, we gave some, patient was a diabetic patient, so we could not give the diclofenac injection. So we gave the tramadol injection, but still after half an hour, 45 minutes also, patient was screaming and it was severe painful. Later on, immediately we thought we'll give the sitz bath. We gave the sitz bath. Patient came out from the sitz bath. Then also patient screamed on us, saying that, doctor, if you knew that by doing this sitz bath, if pains comes down, why didn't you give, since 1 hour I am having pain? That is what it happened. Means that is one of the example how the pain and other things will be managed by doing the sitz bath. That much helpful is a sitz bath in case of any of the bottom case management. That's all from my presentation. If any queries or doubts, kindly welcome.
So, hello, sir.
Yes, madam.
There is no Q&A session. So, thank you, sir. Thank you, sir, for such an informative presentation, sir.
Thank you, madam. I would like to thank Ramakrishna sir, Raghuram Bhatt sir, for giving me an opportunity, and our HOD Kishore sir also for giving me an opportunity, and I thank all of my colleagues for support and all. Thank you one and all.
Thank you once again, sir. So the second presentation is by Dr. Sambat Vanishri. Presently, she is Professor, Department of Shalakitandra. She is a senior physician and an expertized clinician in ENT disorders, that is Shalakitandra, who have given many programs and conducted many health camps. She will be presenting the topic Shalakitandra to prevent COVID-19. Over to you, madam, for the presentation.
Thank you, Dr. Maya. Hari Om. Ellarigu namaskara. Om Shri Dhanvantareye Namaha. ಇಂದಿನ ಈ ಆರೋಗ್ಯಕ್ಕೆ ಆಯುರ್ವೇದ ದಿನಾಚರಣೆಯ ಅಂಗವಾಗಿ ನಡೆಯುತ್ತಿರುವಂತಹ ಈ ಉಪನ್ಯಾಸ ಸರಣಿಯ ಸಾಲಿನಲ್ಲಿ ಇರುವ ಅತ್ಯಂತ ಪ್ರಮುಖ ವಿಷಯ ಅಂದ್ರೆ ಆಯುರ್ವೇದದ ಒಂದು ಅಷ್ಟಾಂಗವಾದಂತಹ ಅಷ್ಟಾಂಗಗಳಲ್ಲಿ ಒಂದು ಆದ ಚಾಲಾಕ್ಯ ತಂತ್ರದಿಂದ ಹೇಗೆ ಈ COVID-19 ಅನ್ನು ತಡೆಗಟ್ಟಬಹುದು ಎಂಬ ಈ ವಿಚಾರನ ಈ ಇಂದಿನ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪ್ರಸ್ತುತಪಡಿಸೋಣ. ಮತ್ತೆ ಹೇಗೆ ಈ COVID-19 ಸುಲಭವಾದಂತಹ ಚಿಕಿತ್ಸಾ ಕ್ರಮಗಳಿಂದ ಅಥವಾ ಮನೆಯಲ್ಲೇ ತೆಗೆದುಕೊಳ್ಳಬಹುದಾದಂತಹ ಔಷಧಿಗಳಿಂದ ತಡೆಗಟ್ಟಬಹುದು ಎಂಬುದರ ಬಗ್ಗೆ ನಮ್ಮ ENT ವಿಭಾಗದಿಂದ, ಆಯುರ್ವೇದದ ENT ವಿಭಾಗದಿಂದ ಯಾವ ರೀತಿಯ ಚಿಕಿತ್ಸೆಗಳನ್ನ ನೀವು ಪಡೆಯಬಹುದು ಎಂಬುದನ್ನ ತಿಳಿದುಕೊಳ್ಳೋಣ. ಆಯುರ್ವೇದದಲ್ಲಿ ಬಹಳಷ್ಟು ಔಷಧಿಗಳು, ಕ್ರಿಯಾಕಲ್ಪಗಳು, ಚಿಕಿತ್ಸಾ ವಿಧಾನಗಳು ಈ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಹೆಚ್ಚು ಸೂಕ್ತವಾಗಿರುತ್ತದೆ. ಆಯುರ್ವೇದ ರೀತಿಯ ಆಹಾರ, ವಿಹಾರ, ಆಚಾರ, ವಿಚಾರಗಳು ದೇಹದಲ್ಲಿ ರೋಗ ಪ್ರತಿಬಂಧಕ ಶಕ್ತಿಯನ್ನ ಹೆಚ್ಚಿಸುತ್ತದೆ. ಪ್ರಪಂಚದಾದ್ಯಂತ ಹೆಚ್ಚಿನ ತೊಂದರೆಯನ್ನು ಉಂಟು ಮಾಡುತ್ತಿರುವಂತಹ COVID-19 ಬಗ್ಗೆ ಈಗಾಗಲೇ ತಮಗೆಲ್ಲರಿಗೂ ಮಾಹಿತಿ ಇದೆ. ಅಂದ್ರೆ ಈ ಕಾಯಿಲೆಯಿಂದ, ಈ ವೈರಸ್ನಿಂದ ಉಂಟಾಗುತ್ತಿರುವಂತಹ ತೊಂದರೆಗಳಾದ್ರೂ ಏನು, ಜನರು ಈ ವೈರಸ್ನಿಂದಾಗಿ ಏಕೆ ಮರಣ ಹೊಂದುತ್ತಿದ್ದಾರೆ, ಮಕ್ಕಳಿಗೂ ವಯಸ್ಸಾದವರಿಗೂ ಹೆಚ್ಚಿನ ತೊಂದರೆ ಏಕೆ ಆಗುತ್ತಿದೆ, ಈ ಕಾಯಿಲೆಯಲ್ಲಿ ಬರಬಹುದಾದಂತಹ ನೈಜ ಲಕ್ಷಣಗಳೇನು, ಸ್ವರೂಪಗಳೇನು ಎಂಬುದನ್ನ ನಾವು ತಿಳಿದುಕೊಂಡ್ರೆ ಅದನ್ನ ಯಾವ ರೀತಿಯಲ್ಲಿ ನಾವು ತಡೆಗಟ್ಟಬಹುದು ಎಂಬುದನ್ನ ತಿಳಿದುಕೊಳ್ಳುವುದು ಸುಲಭ. ಸೊ ಈ COVID-19 ಕಾಯಿಲೆಯ ಲಕ್ಷಣಗಳು ಅಂದ್ರೆ ನಿಮ್ಗೆಲ್ಲ ತಿಳಿದಿರೋ ಹಾಗೆ ಈಗಾಗ್ಲೇ ತಲೆನೋವು, ಜ್ವರ, ನೆಗಡಿ, ಉಸಿರು ಕಟ್ಟುವುದು, ಉಸಿರಾಟದ ತೊಂದರೆಯಾಗುವುದು, ಗಂಟಲಿನ ಬಾಧೆಯಾಗುವುದು, ಆಯಾಸವಾಗುವುದು, ಅತಿಯಾದ ಒಣಕೆಮ್ಮು ಬರುವುದು, ದೇಹದಲ್ಲಿ ಹೆಚ್ಚಿನ ಶ್ರಮ, ಆಲಸ್ಯ ಉಂಟಾಗುವುದು, ಊಟದಲ್ಲಿ ರುಚಿಯಾಗದೇ ಇರುವುದು, ನಾಲಿಗೆಯ ವೈರಸ್ಯ, ಮೂಗಿಗೆ ವಾಸನೆ ಬಾರದೇ ಇರುವುದು ಅಥವಾ ಗಂಧಜ್ಞಾನ ನಾಶವಾಗುವುದು, ಈ ಎಲ್ಲಾ ತೊಂದರೆಗಳು ಒಬ್ಬೊಬ್ಬರಿಗೆ ಒಂದೊಂದು ರೀತಿಯಲ್ಲಿ ವ್ಯಕ್ತವಾಗುತ್ತಾ ಹೋಗುತ್ತದೆ. ಅದರಲ್ಲೂ ಸಹ ಮಕ್ಕಳಿಗೆ ಹಾಗೂ ವಯಸ್ಸಾದವರಿಗೆ ಇದು ಬೇಗ ಹರಡುತ್ತದೆ ಮತ್ತು ಹೆಚ್ಚಿನ ತೊಂದರೆಯನ್ನು ಸಹ ಉಂಟು ಮಾಡುತ್ತದೆ. ಹಾಗಾದರೆ ನಾವು ಈಗ ಆಯುರ್ವೇದದ ಪದ್ಧತಿಯಲ್ಲಿ ಶಾಲಾಕ್ಯ ತಂತ್ರ ವಿಭಾಗದಿಂದ ಹೇಗೆ ಪ್ರಯೋಜನವನ್ನು ಪಡೆದುಕೊಳ್ಳಬಹುದು, ಯಾವ ಯಾವ ಕ್ರಿಯಾಕಲ್ಪಗಳ ಉಪಯೋಗವನ್ನು ಯಾವ ರೀತಿ ಬಳಸಿಕೊಳ್ಳಬಹುದು ಎಂಬುದನ್ನ ತಿಳಿದುಕೊಳ್ಳೋಣ. ಈಗ ಅವಸ್ಥಾ ವಿಶೇಷ ಚಿಕಿತ್ಸಾ ಅಂತ ಹೇಳ್ತಾರೆ. ಅವಸ್ಥಾ ವಿಶೇಷ ಚಿಕಿತ್ಸಾ ಎನ್ನುವುದು ಈ ಸಂದರ್ಭದಲ್ಲಿ ಬಹಳ ಮುಖ್ಯ. ಅಂದ್ರೆ ಯಾವ ರೋಗಿಗಳಿಗೆ, ಯಾವ ತೊಂದರೆಗಳಿಗೆ, ಯಾವ ಚಿಹ್ನೆಗಳು ಯಾವ ಔಷಧಿಗಳು, ಯಾವ ದ್ರವ್ಯಗಳು ಪ್ರಯೋಜನಕಾರಿಯಾಗಬಲ್ಲದು ಎಂಬುದನ್ನ ತಿಳಿದುಕೊಳ್ಳೋಣ. ಚಿಕಿತ್ಸೆ ತೆಗೆದುಕೊಳ್ಳುವ ಅಥವಾ ನೀಡುವ ಮೊದಲು ನಾವು ದೋಷ ಬಲ, ರೋಗ ಬಲ, ರೋಗಿ ಬಲ ಎಲ್ಲವನ್ನೂ ಬಹಳ ಕೂಲಂಕುಷವಾಗಿ ನೋಡಬೇಕಾಗಿರುತ್ತದೆ. ಅದು ಬಹಳ ಮುಖ್ಯವಾಗಿರುತ್ತದೆ. ಆದ್ದರಿಂದ ದೇಹದಲ್ಲಿ ದೋಷಗಳು ಬಲಗೊಳ್ಳುವ ಮೊದಲೇ ದೇಹ ಬಲವನ್ನು ಹೆಚ್ಚಿಸಿಕೊಳ್ಳುವುದು ಅತಿ ಮುಖ್ಯ. ರೋಗದ ಬಲ ಅಂದರೆ ಹೀನವಾಗಿಸಬಲ್ಲದು ಎಂಬುದನ್ನು ತಿಳಿದುಕೊಳ್ಳುವುದು ಬಹಳ ಅವಶ್ಯಕ. ಈ ರೋಗದಲ್ಲಿ ಉಂಟಾಗುವಂತಹ ಓಜೋಕ್ಷೀಣತೆ ಅಂದರೆ ಇಮ್ಯುನಿಟಿ ಲೆವೆಲ್ ದೇಹದಲ್ಲಿ ಕಡಿಮೆಯಾಗುವಂತಹದು. ಅಂದರೆ ರೋಗ ನಿರೋಧಕತ್ವವನ್ನು ಕಡಿಮೆ ಮಾಡುವಂತಹದ್ದು ಈ ವೈರಸ್ಸಿನ ಒಂದು ಲಕ್ಷಣ. ಆದ್ದರಿಂದ ಇದಕ್ಕೆ ಚಿಕಿತ್ಸೆ ಎಂದರೆ ನಮ್ಮ ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿಯನ್ನು ಹೆಚ್ಚಿಸಿಕೊಳ್ಳುವುದು, ಇಮ್ಯುನಿಟಿ ಬಿಲ್ಡಿಂಗ್. ಇದು ಬಹಳ ಮುಖ್ಯ. ಇಲ್ಲಿ ಬಲಂ ಯತ್ನೇನ ಪಾಲಯನ್, ನಾವು ನಮ್ಮ ಪ್ರಯತ್ನದಿಂದ ನಮ್ಮ ದೇಹ ಬಲವನ್ನು ಹೆಚ್ಚಿಸಿಕೊಂಡು ರೋಗದ ಬಲವನ್ನು ಕುಗ್ಗಿಸಬೇಕು. ಅದು ಮೊದಲನೆಯ ನಿಯಮ. ನಮ್ಮ ದೇಹದ ಬಲವನ್ನು ಹೆಚ್ಚಿಸಿಕೊಂಡು ರೋಗಕ್ಕೆ ಪ್ರತಿಬಂಧಕ ಶಕ್ತಿಯನ್ನು ಹೆಚ್ಚಿಸಿಕೊಳ್ಳುವುದರಿಂದ ನಾವು ಈ ಕಾಯಿಲೆಯನ್ನ ತಡೆಗಟ್ಟಬಹುದು. ಅದಕ್ಕಾಗಿ ನಾವು ನಮ್ಮ ಪ್ರತಿನಿತ್ಯ ನಮ್ಮ ಆಹಾರದಲ್ಲಿ ನಮಗೆ ಸುಲಭವಾಗಿ ಸಿಗುವಂತಹ ದ್ರವ್ಯಗಳಾದ ಅರಿಶಿಣ, ಶುಂಠಿ, ನಲ್ಲಿಕಾಯಿ, ನಿಂಬೆಹಣ್ಣು, ಮೆಣಸು, ಏಲಕ್ಕಿ, ಕಾಳು, ಲವಂಗ, ಚಕ್ಕೆ, ಧನಿಯಾ, ತುಳಸಿ, ಅಮೃತಬಳ್ಳಿ, ಕುಮಾರಿ ಇಂತಹ ದ್ರವ್ಯಗಳಿಂದ ನಮ್ಮ ಆಹಾರ ಕ್ರಮವನ್ನು ರೂಪಿಸಿಕೊಂಡು ಇವುಗಳಿಂದ ನಾವು ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿಯನ್ನು ಹೆಚ್ಚಿಸಿಕೊಳ್ಳಬಹುದು ಅಥವಾ ಬಂದ ಲಕ್ಷಣಗಳನ್ನೂ ಕಡಿಮೆ ಮಾಡಬಹುದು ಮತ್ತು ರೋಗವನ್ನು ತಡೆಗಟ್ಟಬಹುದು. ಮತ್ತು ವಿಹಾರದಲ್ಲಿ ಯೋಗ, ಪ್ರಾಣಾಯಾಮ, ಧ್ಯಾನ ಇವನ್ನ ನಮ್ಮ ದೈನಂದಿನ ನಿತ್ಯ ವಿಹಾರಕ್ಕೆ ಅಳವಡಿಸಿಕೊಳ್ಳಬೇಕು. ನಿತ್ಯ ನಮ್ಮ ಜೀವನದಲ್ಲಿ ಸುಲಭವಾಗಿ ಮಾಡಬಹುದಾದಂತಹ ಕ್ರಿಯಾಕರ್ಮಗಳನ್ನು ಸಹ ನಾವು ನೋಡಬಹುದು. ಉದಾಹರಣೆಗೆ ನಸ್ಯಕರ್ಮ, ಗಂಡೂಷ, ಕವಳಗ್ರಹಣ, ಧೂಮಪಾನ, ಕರ್ಣಪೂರ್ಣ ಈ ಎಲ್ಲಾ ಚಿಕಿತ್ಸಾ ಕ್ರಮಗಳನ್ನು ಯಾವ್ಯಾವ ರೀತಿ ಮಾಡಬಹುದೆಂದು ಕೂಡ ನಾವು ಕೊನೆಯಲ್ಲಿ ತಿಳಿದುಕೊಳ್ಳೋಣ. ನಸ್ಯಕರ್ಮಕ್ಕಾಗಿ ನಾವು ತುಳಸಿ ಸ್ವರಸಾದಿ ತೈಲವನ್ನು ಉಪಯೋಗಿಸಬಹುದು, ಅಣು ತೈಲವನ್ನು ಉಪಯೋಗಿಸಬಹುದು. ಮತ್ತು ನಸ್ಯ ಎಂದರೆ ಮೂಗಿಗೆ ನಾವು ಔಷಧಿ ದ್ರವ್ಯಗಳಿಂದ ಸ್ವರಸವಾಗಲಿ ತೈಲವಾಗಲಿ ಹಾಕುವುದು, ನೀಡುವುದು. ಅಂದ್ರೆ ನಸ್ಯ ನೀವೆಲ್ಲರೂ ತಿಳಿದು ಹಂಗೆ ನಸ್ಯ ಅಂದ್ರೆ ಯಾವುದೇ ಒಂದು ಚೂರ್ಣವನ್ನು ತೆಗೆದು ಮೂಗಿಗೆ ಹಾಕಿಕೊಳ್ಳುವುದಲ್ಲ, ಒಂದು ಕ್ರಮವಿಧಾನವಾಗಿ ನಸ್ಯ ಕರ್ಮ ಅಂತ ಒಂದು ಚಿಕಿತ್ಸಾ ಕ್ರಮ, ಆಯುರ್ವೇದದ ಪಂಚಕರ್ಮಗಳಲ್ಲಿ ಒಂದಾದಂತಹ ನಸ್ಯ ಕರ್ಮ, ಇದು ಒಂದು ಪ್ರಧಾನ ಕರ್ಮವಾಗಿದೆ. ಇದರಿಂದ ನಾವು ಈ ವೈರಸ್ ನಮ್ಮ ಮೂಗಿನಿಂದ ಹೇಗೆ ದೇಹದೊಳಗೆ ಪರಿವರ್ತನೆಯಾಗುತ್ತೆ ಅದನ್ನ ಮೂಗಿನಲ್ಲೇ ಅದನ್ನು ತಡೆದು ಮುಂದೆ ಅದು ಕಾಯಿಲೆಯಾಗಿ ಪರಿವರ್ತನೆಯಾಗದಂತೆ ತಡೆಯೋದೇ ಈ ನಸ್ಯಕರ್ಮದ ಉದ್ದೇಶ. ಆ ನಸ್ಯಕರ್ಮಕ್ಕೆ ನಾವು ಅತಿ ಸುಲಭ ದ್ರವ್ಯಗಳಾದಂತಹ ತುಳಸಿ ಆಗಿರಬಹುದು, ಅಮೃತಬಳ್ಳಿ ಸ್ವರಸ ಆಗಿರಬಹುದು, ಅಥವಾ ಅಣು ತೈಲ ಆಗಿರಬಹುದು, ಇದನ್ನ ನಾವು ಮಾಡುವುದರಿಂದ ಪ್ರತಿನಿತ್ಯ ಅದನ್ನ ನಮ್ಮ ಜೀವನದಲ್ಲಿ ಅಳವಡಿಸ್ಕೊಳ್ಳೋದ್ರಿಂದ, ಅಥವಾ ವಾರಕ್ಕೊಮ್ಮೆಯಾಗಲಿ ವಾರಕ್ಕೆ 3 ದಿನ ಆಗ್ಲಿ ಅಳವಡಿಸ್ಕೊಳ್ಳೋದ್ರಿಂದ ನಾವು ಈ ಕಾಯಿಲೆ ದೇಹದೊಳಗೆ ಪ್ರವೇಶ ಮಾಡುವುದನ್ನೇ ನಾವು ತಡೆಯಬಹುದಾಗಿದೆ. ಒಮ್ಮೆ ಈ ವೈರಸ್ ನಮ್ಮ ಮೂಗಿನೊಳಗೆ ಪ್ರವೇಶ ಮಾಡದಿದ್ದರೆ ನಾವು ಸುರಕ್ಷಿತ. ಹಾಗಾಗಿ ಈ ನಸ್ಯಕರ್ಮ ಅತ್ಯಂತ ಶ್ರೇಷ್ಠ ಚಿಕಿತ್ಸಾ ಕ್ರಮ ಎಂದರೆ ತಪ್ಪಾಗಲ್ಲ. ಈಗ ನೆಕ್ಸ್ಟ್ ಅಂದ್ರೆ ಗಂಡೂಷ. ಗಂಡೂಷ ಅಂದ್ರೆ ನಿಮ್ಗೆ ಬಾಯಲ್ಲಿ ಯಾವಾಗ್ಲೂ ನೀವು ನೀರನ್ನ ತುಂಬಿಸ್ಕೋತೀರಾ. ಆ ನೀರು ಎಷ್ಟೊತ್ತು ನಿಮ್ಗೆ ಉಗ್ಯಕ್ಕಾಗಲ್ಲ ಅಥವಾ ಎಷ್ಟೊತ್ತು ನೀವು ಬಾಯಲ್ಲಿ ಇಟ್ಕೋಬಹುದು, ಅಷ್ಟರವರೆಗೂ ಇಟ್ಕೋತೀರಾ. ಆ ತರ ಔಷಧಿ ದ್ರವ್ಯಗಳ ಕಷಾಯಗಳಿಂದ ಮಾಡಿದಂತಹ ದ್ರವ್ಯವನ್ನ ಬಾಯಿಯಲ್ಲಿ ತುಂಬಿಸಿಕೊಳ್ಳುವಂಥದ್ದು ಮತ್ತು ಆ ದ್ರವ್ಯಗಳನ್ನ ಅಥವಾ ತೈಲಗಳನ್ನ ಅಥವಾ ಘೃತಗಳನ್ನ ಉಪಯೋಗಿಸಿ ಬಾಯಿ ಮುಕ್ಕಳಿಸುವುದು, ಇದನ್ನ ಕವಲಗ್ರಹಣ ಅಂತೀವಿ. ಅಂದ್ರೆ ಔಷಧಿ ದ್ರವ್ಯಗಳ ಕಷಾಯಗಳನ್ನ ತೈಲಗಳನ್ನ ನಾವು ಬಾಯಿ ಮುಕ್ಕಳಿಸುವುದರಿಂದ ನಾವು ಈ ವೈರಸ್ನ ಅಲ್ಲೇ ತಡೆಗಟ್ಟಬಹುದು. ಅದು ಒಳಗೆ ಹೋಗಿ ಯಾವುದೇ ರೀತಿಯ ತೊಂದರೆಯನ್ನ ಉಂಟು ಮಾಡದಂತೆ ಕೂಡ ತಡೆಯಬಹುದು. ಮುಂದೆ ಧೂಮಪಾನ ಅಂದ್ರೆ ಔಷಧಿ ದ್ರವ್ಯಗಳಿಂದ ಬರುವಂತಹ ಹೊಗೆಯನ್ನ ಮೂಗಿನಲ್ಲಿ ಬಾಯಿಯಲ್ಲಿ ತುಂಬಿಸಿಕೊಳ್ಳುವುದು. ಅಂದ್ರೆ ನಿಮಗೆ ಈಗಾಗಲೇ ಗೊತ್ತಿರ್ಬೋದು, ಕೆಲವೊಮ್ಮೆ ಮನೆಯಲ್ಲಿ ಕೆಲವು ದ್ರವ್ಯಗಳ ಧೂಪವನ್ನ ಹಾಕಿದ್ರೆ ಆ ಧೂಪದ ಪ್ರಮಾಣ ನಿಮಗೆ ಬರ್ತಾ ಇದ್ರೆ ಅಥವಾ ಆ ಧೂಪದ ಪ್ರಮಾಣಕ್ಕೆ ಅಥವಾ ಧೂಪದ ಹರಡುವಿಕೆಗೆ ಬೇರೆ ಯಾವುದೇ ಕ್ರಿಮಿಕೀಟಗಳಾಗ್ಲಿ ಅಥವಾ ವೈರಸ್ ಆಗ್ಲಿ ಮನೆಗೆ ಎಂಟ್ರಾಗಲ್ಲ. ಇದು ನೀವು ಮೊದಲಿನಿಂದನೂ ಪಾಲಿಸ್ಕೊಂಡು ಬಂದಿರುವಂತ ಒಂದು ಆಚಾರ. ಅದನ್ನೇ ಸ್ವಲ್ಪ ವೈಶೇಷಿಕವಾಗಿ ವೈಜ್ಞಾನಿಕವಾಗಿ ನಾವು ಮಾಡಿದ್ರೆ ಆ ಧೂಮವನ್ನ ನಾವು ಮೂಗಿನಲ್ಲಿ ತೆಗೆದುಕೊಂಡ್ರೆ ಬಾಯಿಯಲ್ಲಿ ತೆಗೆದುಕೊಂಡ್ರೆ ಆ ವೈರಸ್ ನಮ್ಮ ದೇಹದೊಳಕ್ಕೆ ಪ್ರವೇಶ ಮಾಡದಂತೆ ನಾವು ನಿರ್ಬಂಧ ಮಾಡಬಹುದಾಗಿದೆ. ಇದಕ್ಕಾಗಿ ನಾವು ಗುಗ್ಗುಲು ತಿಕ್ತಕ ಘೃತ ಧೂಪವನ್ನು ಮಾಡ್ಕೋಬಹುದು, ಅಥವಾ ಬೇರೆ ಸಾಂಬ್ರಾಣಿ ಧೂಪ ಕೂಡ ನಮ್ಗೆ ಎಷ್ಟೋ ಪ್ರಯೋಜನಕಾರಿಯಾಗಿ ಕೂಡ ಕೆಲಸ ಮಾಡಿ ಈ ವೈರಸ್ ಅನ್ನ ತಡೆಗಟ್ಟುತ್ತೆ. ಮುಂದೆ ಈ ಔಷಧಿ ದ್ರವ್ಯಗಳ ಕಷಾಯಗಳಿಂದ ಹಬೆ ತೆಗೆದುಕೊಳ್ಳೋದು. ಈಗಾಗ್ಲೇ ನಿಮ್ಗೆ ಗೊತ್ತಿರ್ಬೋದು, ಎಲ್ಲಾ ಕಡೆ ಈ ವಿಡಿಯೋಗಳು ಬರ್ತಾ ಇದೆ. ಔಷಧಿ ದ್ರವ್ಯಗಳಿಂದ ನೀವ್ ಯಾವ್ದೇ ಆಗ್ಲಿ ಹಬೆ ತಗೊಂಡ ತಕ್ಷಣ ಇದು ವಾಸಿ ಆಗತ್ತೆ. ಸೈನಸಸ್ ಏನಿರುತ್ತೆ, ಸೈನಸೈಟಿಸ್ ಏನಾರ ಆಗಿತ್ತು ಅಂದ್ರೆ ಅದು ಕಡಿಮೆ ಆಗತ್ತೆ ಅಂತ ಈಗ ಸುಮಾರು ಗೊತ್ತಾಗಿದೆ ಜನಕ್ಕೆ. ಹಾಗೆ ಔಷಧಿ ದ್ರವ್ಯಗಳನ್ನ ಉಪಯೋಗಿಸಿ ಕಷಾಯಗಳನ್ನ ತಯಾರಿಸಿ ಆ ಕಷಾಯಗಳಿಂದ ನಾವು ಹಬೆ ತೆಗೆದುಕೊಳ್ಳೋದ್ರಿಂದ ಈ ವೈರಸ್ ಅನ್ನ ತಡೆಗಟ್ಟಬಹುದು. ಅಥವಾ ಈ ವೈರಸ್ ನಮ್ಮ ದೇಹದೊಳಗೆ ಪ್ರವೇಶ ಮಾಡೋದನ್ನ, ಲಂಗ್ಸ್ ನ ಪ್ರವೇಶ ಮಾಡೋದನ್ನ ತಡೆಬಹುದು. ಮೂಗಿನ ಮಟ್ಟದಲ್ಲೇ ನಾವು ಈ ಕಾಯಿಲೆಯನ್ನ ತಡೆದರೆ, ಹಬೆ ತೆಗೆದುಕೊಳ್ಳುವುದರಿಂದ ಈ ಕಾಯಿಲೆಯನ್ನ ತಡೆದ್ರೆ ಈ ವೈರಸ್ ನಮ್ಮ ದೇಹದೊಳಗೆ ಹೋಗಿ ಬೇರೆ ಎಲ್ಲಾ ತೊಂದರೆಗಳನ್ನ ಉಂಟು ಮಾಡುವುದನ್ನ ಸುಲಭವಾಗಿ ತಡೆಗಟ್ಟಬಹುದು. ಈ ಹಬೆ ತೆಗೆದುಕೊಳ್ಳುವಿಕೆಗೆ ಸ್ಟೀಮಿಂಗ್, ಇದಕ್ಕೆ ಮುಖ್ಯವಾಗಿ ದಶಮೂಲ ಕಷಾಯ ಉಪಯೋಗಿಸಬಹುದು. ತ್ರಿಫಲ ಕಷಾಯಗಳಿಂದ ನಾವು ಹಬೆ ತಗೋಬಹುದು. ಇದು ನಾವು ಮನೆಯಲ್ಲೇ ಈಸಿಯಾಗಿ, ನಿಮ್ಗೆ ಹೆಚ್ಚು ನೀವು ನಿಮ್ಮ ಮಟ್ಟದಲ್ಲೇ ಮನೆಯಲ್ಲೇ ಮಾಡ್ಕೊಳ್ಬಹುದಾದಂತ ಹೆಚ್ಚು ಉಪಯೋಗಕಾರಿ ಚಿಕಿತ್ಸೆಯಾಗಿದೆ. ಇದ್ರ ಜೊತೆಯಲ್ಲಿ ನಿತ್ಯ ರಸಾಯನವನ್ನ ಸೇವನೆ ಮಾಡುವುದು. ಅಂದ್ರೆ ನಿತ್ಯ ರಸಾಯನ ಅಂದ್ರೆ ನಿಮ್ಗೆ ಮಾಮೂಲಾಗಿ ನೀವು ಎಲ್ಲರಿಗೂ ಈಗ ಮಾಹಿತಿ ಇದೆ, ಚವನಪ್ರಾಶ ತಗೋಬಹುದು. ನಿತ್ಯ ರಸಾಯನ, ನೈಮಿತಿಕ ರಸಾಯನ ಅಂತ ಹೇಳ್ತೀವಿ. ನಿತ್ಯ ಚವನಪ್ರಾಶ ಸೇವನೆ ಮಾಡುವುದು, ಅಥವಾ ಏನಾರ ತೊಂದರೆ ಇದ್ದಲ್ಲಿ ಕೆಮ್ಮು ನೆಗಡಿ ಅಂತಹ ಯಾವ್ದಾನ ಒಂದು ಸಣ್ಣ ತೊಂದರೆ ಇತ್ತು ಅಂದ್ರೆ ಅವರು ಅಗಸ್ತ್ಯ ರಸಾಯನವನ್ನು ತೆಗೆದುಕೊಳ್ಳುವಂಥದ್ದು. ಮತ್ತೆ ವಯಸ್ಸಾದವರು ಮತ್ತೆ ಶಕ್ತಿಹೀನರು, ಬಲಹೀನರಾಗಿದ್ರೆ ಅಂತವ್ರು ಅಶ್ವಗಂಧ ರಸಾಯನ ಸೇವನೆಯನ್ನ ಮಾಡೋದು. ಇದೆಲ್ಲ ನಿತ್ಯ ರಸಾಯನವಾಗಿ ಕೆಲಸ ಮಾಡುತ್ತೆ ಮತ್ತು ಅತ್ಯಂತ ಉಪಯುಕ್ತವಾಗಿದೆ. ಆ ಅಮೃತ ಸತ್ವವನ್ನ ಜೇನುತುಪ್ಪದ ಜೊತೆಯಲ್ಲಿ ಸೇವಿಸಿದ್ರು ಕೂಡ ಅದು ಉತ್ತಮವಾಗಿ ಕೆಲಸ ಮಾಡುತ್ತೆ. ಸೊ ಈ ಎಲ್ಲ ಕ್ರಮಗಳನ್ನ ನೀವು ನಿಮ್ಮ ದೈನಂದಿನ ಚಟುವಟಿಕೆಗಳಿಗೆ ಅನುಸಾರವಾಗಿ ನೀವು ಅಳವಡಿಸ್ಕೊಂಡ್ರೆ ಈ ಕಾಯಿಲೆಯನ್ನ ತಡೆಗಟ್ಟಬಹುದು ಮತ್ತು ಯಶಸ್ವಿಯಾಗಿ ಈ ಕಾಯಿಲೆಯಿಂದ ಹೊರಗೆ ಬರಬಹುದು. ಈಗ ಇದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತ ಒಂದೆರಡು ಚಿಕಿತ್ಸಾ ಕ್ರಮಗಳನ್ನ ನೋಡೋಣ. ಈಗ ನೋಡಿ, ನಸ್ಯಕರ್ಮ. ಮೂಗಿಗೆ ಔಷಧಿ ದ್ರವ್ಯವನ್ನ ಹಾಕುವುದು. ನಾವು ನಾಸಾಹಿ ಶಿರಸೋದ್ವಾರಂ ಅಂತ ಹೇಳ್ತೀವಿ. ನಮಗೆ ಏನೇ ಕಾಯಿಲೆಯನ್ನ ಬಂದ್ರು ನಾವು ಅದಕ್ಕೆ ಮೂಗು ದ್ವಾರವಾಗಿದೆ. ಶಿರಸ್ಸಿಗೆ ಮೂಗೆ ದ್ವಾರ. ಸೊ ನಾವು ಇದನ್ನ ರಕ್ಷಣೆ ಪಡ್ಕೋಬೇಕು. ಈ ಕಾಯಿಲೆಯಿಂದ ರಕ್ಷಣೆ ಪಡ್ಕೋಬೇಕು ಅಂತಂದ್ರೆ ಮೂಗಿನ ಮೂಲಕವಾಗಿ ಔಷಧಿ ದ್ರವ್ಯವನ್ನ ಹಾಕುವುದು. ಇದು ಔಷಧಿ ದ್ರವ್ಯವನ್ನ ಮೂಗಿನ ಮುಖಾಂತರ ಹಾಕುವಂಥದ್ದು. It is a therapy in which the medicine is administered through the nostrils, either in the form of powder, liquid, oil, or smoke. So only it is known as nasya, and the procedure is known as nasya karma. ಇದರಲ್ಲಿ ಹಲವಾರು ವಿಧಾನಗಳಿದೆ. ಈ ವಿಧಾನಗಳನ್ನು ನೋಡಿ. ನಾಮನ ನಸ್ಯ, ಅವಪೀಡನ ನಸ್ಯ, ಮರ್ಶನಸ್ಯ, ಪ್ರತಿಮರ್ಶನಸ್ಯ, ಹಲವು ವಿಧಾನಗಳಿದೆ ಈ ನಸ್ಯಕರ್ಮದಲ್ಲಿ. ಸ್ನೇಹನ ನಸ್ಯ, ಶೋಧನ ನಸ್ಯ, ಅವಪೀಡನ ನಸ್ಯ, ಪ್ರಥಮನ ನಸ್ಯ. ಮತ್ತೆ ಮಾಮೂಲಾಗಿ ನಾವು ಯಾವ ಯಾವ ಕಾಯಿಲೆಗಳಿಗೆ ಇದನ್ನ ಮಾಡಬಹುದು ಅಂತ ಹೇಗ್ ಕೆಲಸ ಮಾಡುತ್ತೆ ನಸ್ಯಕರ್ಮ ಅಂತ. ನಾವು ಮೂಗಿಗೆ ಹಾಕದಂತಹ ಔಷಧಿಗಳು ಯಾವ ರೀತಿ ಕೆಲಸ ಮಾಡುತ್ತೆ, ಎಷ್ಟು ಹೊತ್ತು ಮಾಡ್ಬೇಕು, ಎಷ್ಟು ದಿನ ಮಾಡ್ಬೇಕು, ಯಾವ್ಯಾವ ಔಷಧಿಗಳು ಉಪಯೋಗಿಸ್ಬೇಕು. ಇದಕ್ಕೆ ಸುಮಾರಾಗಿ ಈ ಎಲ್ಲ ಔಷಧಿಗಳು ಅಣು ತೈಲ, ಷಡ್ಬಿಂದು ತೈಲ, ಕ್ಲಾರಿಫೈಡ್ ಬಟರ್, ಜೀವಂತ್ಯಾದಿ ಘೃತ, ಜಾತ್ಯಾದಿ ತೈಲ ಇವೆಲ್ಲಾನು ಉಪಯೋಗಿಸಬಹುದು. ಯೂಶುವಲ್ ಆಗಿ ಉಪಯೋಗಿಸುವಂತ ಚೂರ್ಣಗಳು ಮರೀಚ ಚೂರ್ಣ, ವಿಡಂಗ ಚೂರ್ಣ, ತ್ರಿಕಟು, ಕಟ್ಫಲ, ಈ ಎಲ್ಲ ಮಾಮೂಲಾದ ಔಷಧಿ ದ್ರವ್ಯಗಳನ್ನ ಉಪಯೋಗಿಸಿ ನಾವು ನಸ್ಯಕರ್ಮವನ್ನ ಮಾಡಬಹುದು. ವಿಶೇಷವಾದ ಔಷಧಿ ದ್ರವ್ಯಗಳನ್ನು ಕೂಡ ಉಪಯೋಗಿಸಿ ನಸ್ಯಕರ್ಮವನ್ನ ಮಾಡಬಹುದು. ಮುಂದೆ ಧೂಮಪಾನ, ನಾವು ಹೇಗೆ ಧೂಮಪಾನವನ್ನ ತೆಗೆದುಕೊಳ್ಳಬೇಕು, ಔಷಧಿ ದ್ರವ್ಯಗಳಿಂದ how to take herbal smoking, taking of medicated smoke either through the mouth or nose and releasing it through mouth is called dhumapana. It is best in prevention and elimination of diseases of the head and neck. There are so many types: snigdha dhuma, madhya dhuma, tikshna dhuma, mild, medium, strong, mrudu, prayogika अथवा शमन, वैरेचन, to cure of diseases which have already risen. Always. ಯಾರ್ಯಾರ್ ಮಾಡಬಾರ್ದು, ಇದು ತುಂಬಾ ಮುಖ್ಯ. The persons who are suffering from raktapitta, who have undergone purgation, enlargement of abdomen, diabetes, blindness, upward movement of vata, flatulence, and so we have seen how ಧೂಮಪಾನ is done. ನಾವೀಗ ಧೂಮಪಾನ ಹೇಗೆ ಮಾಡೋದು, ನಸ್ಯಕರ್ಮ ಹೇಗೆ ಮಾಡೋದು, ಮತ್ತೆ ಅದರಿಂದ ಯಾವ ರೀತಿಯ ಪ್ರಯೋಜನ ಇದೆ ಅಂತ ತಿಳ್ಕೊಂಡಿದೀವಿ. ಹೀಗೆ ನಮ್ಮ ಶಾಲಾಕ್ಯ ತಂತ್ರದ ಚಿಕಿತ್ಸಾ ಕ್ರಮಗಳನ್ನ ಉಪಯೋಗಿಸಿ ಕೋವಿಡ್-19 ತಡೆಗಟ್ಟುವಿಕೆಯ ವಿಧಾನವನ್ನ ತಿಳಿದುಕೊಂಡಿದ್ದೇವೆ. ಹೆಚ್ಚಿನ ಮಾಹಿತಿಗೆ ನೀವು ತಜ್ಞ ಆಯುರ್ವೇದ ವೈದ್ಯರನ್ನ ಕಾಣಬೇಕಾಗತ್ತೆ ಮತ್ತು ಮನೆಯಲ್ಲೇ ಉಪಯೋಗಿಸಬಹುದಾದಂತಹ ಔಷಧಿ ದ್ರವ್ಯಗಳನ್ನ ಸೇವಿಸಿ ನಿಮ್ಮ ಆರೋಗ್ಯವನ್ನ ಹೆಚ್ಚಿಸಿಕೊಳ್ಳಬಹುದು, ಕೋವಿಡ್-19 ತಡೆಗಟ್ಟಬಹುದು ಅಂತ ಹೇಳಿ ಇಂದಿನ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನನ್ನನ್ನು ಕರೆಸಿದಂತಹ ಈ ಕಾಲೇಜಿನ ಪ್ರಾಚಾರ್ಯರಿಗೆ ನನ್ನ ವಂದನೆಗಳು ಹಾಗೂ ಸುಶ್ರುತ ಆಯುರ್ವೇದ ಕಾಲೇಜಿನ ನಿರ್ದೇಶಕರು ಹಾಗೂ ವಿಶ್ವ ಆಯುರ್ವೇದ ಪರಿಷತ್ತಿನ ಅಧ್ಯಕ್ಷರು ಆದಂತಹ ಡಾಕ್ಟರ್ BR ರಾಮಕೃಷ್ಣ ಸರ್ ಅವರಿಗೆ ನನ್ನ ವಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತಾ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ಮುಗಿಸುತ್ತೇನೆ ಹಾಗೂ ತಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ Namaste.
Thank you, madam, for such a good presentation. The third presentation is by Dr. Rubayal, Professor and HOD, Department of Shala Ketandra, on the topic Prevention of Eye Infections through Ayurveda in COVID-19. I welcome you for the presentation, madam.
Thank you, Dr. Maya. Namaste. Welcome. I welcome you all for this next session. What I am going to tell. Till now, you all know that what is that anorectal disease and its treatment in Ayurveda. Next, ENT related diseases. So how we are going to treat in this COVID-19 situation. So after that, so very important part in our body is eye. So as Ayurveda quotes, Sarvendriyanam Nayanam Pradhanam. So among all Indriyas, this eye is considered as one of the important Indriya. Okay, so how we have to control this eye infections? Because nowadays it is very important as we are exposing outside in this COVID-19. So we have to protect eye infections. So even after when you get eye infections, how we can prevent it through Ayurveda? So that we will know today. So what are all the common things like in the food form or in the fruits or in the vegetables? So commonly which are available near to our house. So how they will improve our eyesight. So that I am going to explain today. So before going to explain the this one, what are all the things we have to know, how we have to avoid the eye infections. So eye infections commonly it may be viral or fungal or bacterial. So in these pictures you can see. So usually all of us will get like these symptoms. Maybe may not be. So few may get or few may not get. Okay, so but we should aware of these infections, how these infections in present life they are going to affect to our routine life. Because if we get eye infections, so we can't go hospital directly. So in this situation, so how we can manage it in our home, or so whether the drugs which are nearer to our home that are useful or not, that we will discuss. So what are all the common eye infections? So by seeing these pictures, you can understand. So these are all the very common infections day-to-day life we are facing. That is pink eye. Pink eye refers to the redness of the eye. So almost all the peoples when they will exposure to the outside atmosphere or dry sun rays, they will get this allergic type of redness will be there in eye. So that is called as pink eye. Next is stye. In second picture, you can see. So this is an external swelling of the lid. So third one is blepharitis. So blepharitis refers to the one of the eye infections, which commonly we can see in almost all the peoples because of their dandruff. Next is keratitis. Keratitis refers to the corneal inflammation. That is swelling will be there in cornea. Due to that, we will have so many symptoms like watering, burning sensation or itching sensation, etc. Next is corneal ulcer. So corneal ulcer, so this fifth picture you can see. So the person will get some scratching like ulcer over the cornea, so which will disturbs our routine life. Next is trachoma, chalazion, periorbital, orbital cellates. So I am telling it scientifically, but so as a normal person or layman's, so we will have all these symptoms without knowing what is this disease or how can I treat this disease by Ayurveda or home remedy, that we don't know. So how we can prevent our eye infections? New share ಮಾಡಿ. Now it's okay. ಯಾವ್ದ್ರಲ್ಲಿ ಇದರಲ್ಲಿ ಬರ್ತಾ ಇಲ್ಲ, ಅದು ಎನೇಬಲ್ ಮಾಡಿಲ್ಲ ಅನ್ಸುತ್ತೆ. ಅಂತ enable. Okay. Okay, so how to prevent this eye infections? So as all of us know that these are all the common points we have to follow. So nowadays we are following it. So even though after that I want to tell so how we can prevent our this eye infection by you doing all this. So because it was explained earlier in our classics only, prasangat, gatra samsparsha, sahashaya, sahabhojanat. So all these terms are there which are explained in our Ayurvedic classics. We have to avoid touching our eyes directly. So we have to wash our hands frequently, use clean towels and washed cloth daily, because we have to change because of this present scenario. So we have to follow all these things. Otherwise, definitely we will get eye infections, because whenever we will touch any surface, so immediately we will touch our eyes. So what happens? The infection or the virus present there, so that will goes to the eyes. So especially after touching dirty or dusty surfaces. If we are using contact lenses, always it should be cleaned and then store them correctly. So avoid sharing eye cosmetics, whatever it may be, or this eye cosmetics or face cosmetics, brushes, cloths, all these should be avoided. So don't share the towels. So these are the routine things what we are doing in our home. So even after that I want to tell, because all of you should follow so these preventive measures. Next, so after that, so we'll move on to the common things which we are using at our home. So the things which we are using for our cooking purpose are as a regular in our routine life. First is ginger and turmeric. So what is the importance of this ginger and turmeric in present scenario? So this we have to use frequently or oftenly or required quantity. So in our day-to-day life. So turmeric, what is the action of this turmeric? So this turmeric will do the inflammation. It will reduce the inflammation. And ginger tea, almost all of us drinking this ginger tea has been proven to help improve our eyesight to an extent. And also, so this can also be added as a slices in juices or in drinking milk or any juices. So that made from the carrots. So because carrot is one of the important vegetable which helps to improve the eyesight, and also it contains vitamin A. Next is, what are all the fruits? Mainly citric content fruits which helps us to maintain our eye in a healthy status. Oranges and other citric fruit contains vitamin C, which is the main key for our healthy status of eye. And also the vitamins which found in fresh fruits and vegetables, which contributes to the healthy blood vessels in our eyes. So it can also helps in the development, or it can also combat, means it can avoid in the development of the cataract and in the combination with other vitamins and the nutrients. Age-related macular degeneration. So these are all the normal, this one. Age-related, some eye changes will be there that can be prevented by this fruit. That is orange or any citric content fruits, or that fruit which contains vitamin C. Next. So commonly used in our kitchens, that is garlic and onions. So these will have rich in sulfur, so which are important for the production of glutathione, an important sulfur which containing the protein. So that act as an antioxidant. So by the excess usage of this onion and garlic, so it act as an antioxidant for the lens, which will give strength to our lens. Next is banana. So a banana or an apple, it keeps the doctor away. It is it is there. So eating a banana daily is like a boost. We are giving, or we are boosting our eye health to prevent the vision related diseases. So many researchers have found that banana have a carotenoid, a compound, so that turn fruits and vegetables red, orange or yellow fruits, which are mainly rich in vitamin A. Because vitamin A is one of the important precursors or important source which is required for the healthy status of our eye. Next is honey. So honey, all of you know, so usually some people will take this honey early morning in empty stomach with a cup of water. So here in eye infection, how we can avoid these eye infections by using honey? So topically applied honey can reduce the inflammation. So previous slides I have showed some of the diseases which are having the inflammation or the swelling. So by the application of this honey, we can avoid we can reduce the inflammation and irritation to our eyes. So what is the action of this honey? So it will kill the harmful bacteria. So that would be causing an eye infections. And some people even use honey to try gradually change the color of their eyes. But it is not proved in researches, but still research is going on. So regular application of honey will change the color. So that is not proved by researchers. Next, what are all the common foods we have to use in our daily routine life? So green leafy vegetables, spinach, eggs, nuts, beans, carrot are protein-rich sources, are the fruits which contains rich in vitamin C. So an apple per day keeps the doctor away. So this apple is also having the very much important in improving the eyesight as well as to keep our eye in a healthy status. Because an apple, if you eat a single apple per day, it will keep our eye stronger and in a healthy status to avoid eye infections. So everyone should go for an apple, banana or the fruits which is having fruits which contains the vitamin C. Next, cucumber. So cucumber, all of us will eat along with food. So as it is also rich and hydrates our body. So in the sense, along with body, it also hydrates our delicate eye. So the skin which is present beneath the eye, that will also hydrated by cucumber, because it is vitamin, it contains vitamin K, which helps in the reduction of the inflammation. And also discoloration. Discoloration means any inflammatory condition, either it may be redness or the inflammation of the eye, cystic swelling. So these are all will reduce by the intake of this cucumber. Next, after that, just we will go on, or we have to know the drugs which are nearer to our house, which helps in the reduction of this eye infection. How we can avoid these eye infections by using our Ayurvedic drugs. So one main combination of 3 drugs is there in our Ayurveda. We call it as Triphala. So almost all village peoples are those who are pandits, Arlekai Pandit, we call it as. So they will use these 3 drugs. That is, first one is Haritaki. So this Haritaki, we call it as king of all herbs. So in Kannada, it is named as Arlekai. Okay. So this combination, Aritaki, Vibitaki, and Amlaki. So these three drugs are used either in combination or in a single drug use. So in our Ayurvedic classics, to treat the eye infections, we are using it either in the form of churna along with honey, or in the form of kashaya, or in the form of sarasa. We are using it. So in kashaya, so like there are so many treatment principles are there in our classics, that is in Shalakya, mainly for eye. Some of the important kriya kalpas are mentioned. So whatever the drug I am telling now, so that we are going to use it either in the seka form, that is we are going to pour a medicated liquid, or drops, ashotana form. That is we will prepare the medicated medicine, and we are going to pour in the drops form. And next, so many grutas are there, and procedures are there like tarpana, pindi, bidalaka. So the drugs, the leaves, the combination of these drugs, we will prepare some medicine, that is in the paste form or in the liquid form. So many formulations are there. So in that formulations, we are going to use all these drugs, what I am going to explain now. So first one is Haritaki, that is Arlekai. So which commonly village peoples will know, and they will use this drug in the different inflammatory conditions. Next is Amlaki. So Amlaki, that is Nellikai. So in Kannada, it is named as Nellikai. So Nellikai, the fruit of this plant is used in for so many purposes. It is considered as a rasayana also. So in the same way, this fruit, either churna or in the kashaya form, we are going to use to reduce the inflammatory conditions of eye, or this fruit. So intake, a regular intake of this amlaki will reduce the eye inflammation. Next is vibitaki, that is tarekai. So same, these three are having the same action on the inflammatory conditions. Next is shirisha, that is bagemara. So here the part is used fruit. This also will get commonly outside, that is near village peoples, they will know this. So this fruit will be boiled, and we have to prepare kashaya, or these fruits are dried and churna. That churna, once saying either it kashaya churna or sukshma churna, it is taken internally to reduce the inflammation. Next is haridra. So that is harishina. In Kannada, it is called as. So this already I have explained, as it is having the antibiotic action and antiseptic action, anti-inflammatory, anti-allergic, and blood cleansing action. So we can use this in different ways to treat to prevent the eye infections. Next is Grutakumari, that is Lolesara. So this is one of the common drug which helps to reduce the eye inflammation, or it can prevent the eye infections. Like, so everybody, so those who will have any redness of eye, itching or watering, so commonly what they will do, so they will take the pulp of this Grutakumari and they will keep on their closed eyelids. So for 3 to 5 minutes. So in Ayurveda, one procedure is there in Kriya Kalpa, it is called as Pindi. So in the Pindi form, they are going to keep it. So without consulting the, in village peoples, I am telling. So without consulting any doctors, they will do themselves treatment by using this Grutakumari drug. Next is Babbulu. So this is also one of the common drug we'll get. That is in Kannada, it is called as Karijali. So the fruit of this drug. So this fruit of this drug is used to treat the this external inflammation, that is cystic swelling, or that is pink eye, what I told, allergic conjunctivitis. So in mainly these two conditions in the seka form. So we can use this Babbulu drug to treat or to avoid the eye infections. Next is Shigru. Shigru, that is in Kannada, it is called as Nuggemara. So almost all of us know that. So this is best rasayana also. So this Shigru Patra Swarasa Aschotana. So fresh leaves we have to take, we have to crush it without adding any water. And that Swarasa is used as a Aschotana, that is in the drops form, because it's a medicated drug, medicine. But even though without knowingly, so we can do it. It is very Tikshna in nature when you will put a drop prepared by this Swarasa. So that will irritate for a fraction of minute, but it will cure the inflammation. That is, as we put antibiotic drugs, it may take time, but when you put this Swarasa Aschotana, so it will reduce the inflammation within 6 to 8 hours. Next is Durva. So that is Garke. In Kannada we call it as Garke. So it is available all over the this one city also. So and in villages. So this Swarasa Aschotana or Kashaya Seka. So this Durva Swarasa Kashaya can be given internally to reduce the inflammation of the eyes, and we can avoid the eye infections. And as a regular, we can take 50 ml of Durva Swarasa, so internally, to avoid the eye infections or to keep our eye in healthy status. Next is Erenda, that is Harale Gida or Arale Kai, we call it as. So this Erenda is having the all parts of this plant is useful in Ayurveda, but along with that, so the leaves and the fruits are the main, in Ayurveda we call it as best Vata Shamaka, which reduces the Vata. So here this Kashaya or this Swarasa is mainly used in the form of Seka or Aschotana. So in this Netra Kriya Kalpas, this is used frequently to reduce the Vata as well as the inflammatory conditions. Next drug which is useful to reduce eye infections or to prevent our eye in a healthy status is Vasa. That is, in Kannada it is called as Adu Soge. In Kannada it is called as Adu Soge. So Adu Muttada Soppilla anta heltaru. So this is one of the best medicine in this drug. So we are going to use the leaves and flowers of this medicine to prepare Kashaya and Swarasa. So depending on the condition of the patient, whether the person is having any ulcers in eye or external inflammation is there or internal inflammation. So depending on that, we have to prepare the formulation, either in the churna form, whether you are going to apply in the form of lepa, that is bidalaka form, or in the Swarasa form, you are going to put the drops or the Seka, that is, in the drops form. So that we have to select depending on the condition of the patient as well as the disease. Next is Sariva, that is Sogade Gida, it is called as in Kannada. So this is also one of the drug which is frequently used. The mool of this drug is, that is root, is mainly used to reduce the inflammation. These roots are, that is Kashaya is prepared with the help of these roots. And that Kashaya is used in these conditions like what I explained in last. So mainly conjunctivitis, that is pink eye, is one of the main frequent disease we are getting frequently because of the exposure to the outside atmosphere, or when you expose to the any infective conditions, that is viral or bacterial or fungal infections. To reduce the inflammation, we are going to use this in the Kashaya form. Next important is Guduchi, that is Amrutaballi. So every old or the peoples who knows the importance of this drug, they will use this Amrutaballi or Guduchi. So in a different way, we will use this. And this Amrutaballi is considered as one of the main drug in Ayurveda because the name itself indicates it acts as an Amruta. So it is used in the Swarasa and Kashaya form. Last but not the least drug is Punarnava. In Kannada it is called as Komme Soppu. So this leaves of this drug, so they will take internally, they will prepare the Kashaya and they will consume orally daily 50 ml depending on the patient's requirement or the person requirement. So this will prevent the eye infections along with that. So if the person is having eye infections, they can also take, in healthy persons also, we can use this drug. Thank you. So lastly, I want to tell, so by all this, you have to know that what is the importance of Ayurveda. So Ayurveda along with the importance of eye, how we can avoid the eye infections by using all these drugs. Okay, thank you. Thank you one and all.
Thank you, madam, for the wonderful presentation. Now, on behalf of the organizing team, it is my privilege to propose the vote of thanks. First and foremost, I would like to thank all the presenters for rendering valuable speech. I express my heartfelt thanks to our Director and President of Vishwa Ayurveda Parishad, Dr. B.R. Ramakrishna sir, for his vision and commitment. We are always grateful to our Principal, Dr. Rigrama Bhatta, for enlightening us with his support. And I extend my thanks to Dr. Vasudev Vaidya, AO and DMS, SAMC and H. I humbly express my thanks to all my colleagues for their constant support for enriching the program, and also our students and all others who have joined with us today. Thank you one and all.